Dear Chairman, dear ladies and gentlemen, I'm very honored to be invited to give my presentation. I come from Beijing, China. My name is Xiangyan RUAN. It means a lucky bird forever. As a lucky bird, I welcome all of you to visit famous China, Forbidden City, and the Great Wall. Today, my presentation name is Breast Cancer Risk and Hormone Replacement Therapy. Is the choice of progestogen important? As all of know, during HRT, the doctors and the patients all very care about HRT and the breast cancer risk. About these issues, recently, together with Professor Milk, we published the review. I will today is my presentation structure. I will from evidence based on experimental and evidence based on clinical study and practical consequence give my presentation. First, I began from evidence based on experimental studies according mechanisms of carcinogenesis. As just now, Professor Milker presented the two main mechanisms of hormone-dependent carcinogenesis. One is proliferation mechanisms, is proliferation just pro-exciting cancer cells. The two, development of potential gynecologic estrogen metabolism, which can lead to DNA damages followed by mutations and finally to breast cancer. Development of clinical diagnosed breast cancer needs a clone of more than 1,000 million cancer cells. But if just one breast cancer cells we can't see is the breast cancer. If development to clinical diagnosed breast cancer needs long-term, more than 10 years with estrogen only. But during this long time, all carcinoprotective effects can work, which can explain the decrease of risk using estrogen-only therapy in the WI study. About the estrogen carcinoprotective mechanisms, have published the review. Estrogen-induced apoptosis can destroy cancer cells before proliferation up to a clinic diagnosed cancer. But combination with certain progestogens can increase proliferation, leading to clinical cancer in short time, about 5 to 6 years. During this short time, protection mechanisms can't work. Now, also the rank is already well known as essential for bone function, but according to research results of new research, also responsible for proliferation of breast cancers, as demonstrated in the mouse model published in Nature. Progesterone receptor membrane bond high expressed in patients with breast cancer, mediating progestin effects via crosstalk with other cell components. About progesterone receptor membrane component 1, our cooperation research team have done many work about this. Professor Milk have got the first scientific prize in 2008 World Congress Menopausal. And I also got the first prize in last year German Society of Sonology. We also, about this research, we also got the auditor in the Menopausal Society last year. The editorial is, can the increase in breast cancer observed in the estrogen plus progestin arm of WHI be explained by estrogen receptor membrane component 1? We researched all types of progestogens available and estrogen available. Here is we published just this year we published about normegeston. It has no effect, breast cancer proliferation effect. We also published about progesterone-dependent proliferation mechanisms. We collaboration research between China and Germany. We also do many research about this. Yesterday, I also gave the oral presentation and the poster about our research. Progestogens and breast cancer summary of experimental in vivo results regarding proliferation. The effects of estrogen as well as progestogen are clearly dose-dependent. Certain progestogens can increase the proliferation by acting on the membrane-bound progesterone receptor. Progesterone, even in high dosages, and some synthetic progestogens react remarkably neutral, showing different experiments. Screen for the progesterone membrane receptor could identify the woman of high risk using certain synthetic progestogens. Evidence based on clinical studies according state-of-the-art medicine. You all know WHI study it divided two arms, but the study just only one HRT preparation was tested. The estrogen-only arm, the result is decreased risk for breast cancer. But the combined estrogen and progestogen MPA, the arm results is increased risk for breast cancer. The WHI, the evaluation with E only, significant decrease of breast cancer persisted after stop of hormones. This follow-up 6 years. Also, breast cancer risk in the most important large studies using synthetic progestogens. Also, we all know that WHI study 2002 and the nurse study is very old, is 1995, and the Million Women study is 2003, and the USA study 2003. All the study use MPA and NET and RNG. The breast cancer risk is increased. But E3 study have the different results. It's an important research about the breast cancer risk. You can see the estradiol plus micronized progesterone and estradiol plus progesterone, the breast cancer risk have no effect. But if estrogen plus synthetic progesterone, such as MPA and ET, the breast cancer risk increased. The last point, practical sequences. Updated MS recommendations on postmenopausal hormone therapy and mechanized progesterone or progesterone used in association with oral or percutaneous estradiol may be associated with a better risk profile of breast cancer than synthetic progestogens. We talking about breast cancer risk. In fact, the breast cancer risk is very low. This WHO study in absolutely numbers, the risks are very low. It's 1,000 women per year, just one case. However, certain women may be of high risk. Therefore, further research must identify those women who may have a higher risk of breast cancer during HRT. Further research, we are going to do the international cooperation project, China together with Germany. We will do screen patients of high risk during HRT, assessment of membrane-bound progesterone receptor in the blood, compare patients with breast cancer and healthy women. At last, I answer the question, breast cancer risk and hormone replacement therapy, is the choice of progesterone important? My answer is yes. At last, I want to give my greatest thanks to my teacher, Professor Milk, and my hospital president, Professor Chao, gave the very good opportunity and support to do this work and to do the cooperation project. Thank you for your attention. Finished.